As the World International Nurses Day, South Africa continues to face a critical shortage of medics. The country's leading private healthcare providers warn that more nurses must be trained to meet the growing demand. Newzroom Afrika goes behind the scenes to see what it takes to be a nurse in South Africa today and the vital role they play.
Organization for Economic Cooperation and Development data, South Africa has just one nurse for every 1,000 people. This is far below the world average of 8 per 1,000 people. Life Healthcare's Chief Nurse Officer, Merle Victor, believes more nurses should be trained.
Offer the necessary training. Give us the training numbers to put the numbers out there. We know there's a massive shortage at the moment. All we want is the ability to train and to equip nurses so that ultimately we can ensure good patient outcomes.
Despite the dire shortage of nurses that puts a strain on the existing workforce, young nursing students are still eager to make an impact on the lives of others.
For the future of nursing, I think we're headed towards somewhere where we are seeing really passionate young people who have an innate desire to care for people. And I think that's where we're headed. So yeah, that makes me really excited.
I have a soft spot for vulnerability. And I think I really want to give someone, when someone is scared and they're alone, they're in a new environment, they're sick, there's a lot of things sinking in on them. It could be a little bit overwhelming. So I was thinking I wanted to be there, and then maybe I can make a difference for that person when no one else is willing to hold their hand. Maybe I could do that for them.
Like the populations they serve, the nursing workforce is also aging. Life Healthcare nurse educator Glenn Malape says the theme for this year's National Nurses Day is critical to ensure adequate nurses in the future.
They are the next generation. I think our lives depend on these people, so it's very important that we groom them to the best of our abilities and to make sure that we have the best possible nurses.
The current nursing shortage has been estimated at more than 26,000 professionals, but this number is expected to rise by 2030. For Newzroom Afrika on Channel 405, I'm Zanele Ngumbela in Johannesburg.
For more on this, we're joined by Merle Victor, the Chief Nurse Officer at Life Healthcare. Very good evening to you. Happy International Nurses Day. What does such a day mean to you?
Good evening, Paul, and good evening to your viewers. A very special day today. It's a day where we feel that nurses can get acknowledged for the good that they bring to our society, for all their tireless efforts in ensuring that we treat our patients, that we nurse them back to health, that we have a positive impact on their lives as well. It's a day where I feel that the public must then realize the plight of nurses as well as really the contribution that they make to society, as well as to our policymakers to realize that we need to invest in our nurses and we need to ensure their future. Because if we don't, our communities are the ones that's going to suffer.
I mean, what's interesting, especially what's come out of International Nurses Day, is the International Council of Nurses finding that the healthcare professionals are still bearing the brunt of not only the mounting backlogs of work post-COVID-19, but the day-to-day harsh effects nurse shortages on a global scale. South Africa alone experiencing a shortage of 26,000 nurses, and this of course, is foreseen to even get worse in the years to come. Where are the loopholes? Where's the country falling short?
We're not putting through enough nursing numbers. We're not impacting on the pipeline that is necessary to increase the amount of nurses to take care of our society. There are too many bureaucratic decisions and that impacts on this. So what we found is that our training numbers has been impacted quite adversely. What we have also found is that training for our specialist nurses has ceased in 2020 because of our new qualification framework. So our plea really to our regulators and to our health bodies is to please assist us. Let us join hands together. Let's form partnerships. We are able to train 3,000 nurses a year within Life Healthcare. And you can imagine how that can contribute to the greater good.
What kind of specialist nursing skills are needed? What are you referring to?
I'm referring to midwives, critical care nurses, perioperative nurses who work in theatres, renal nurses, advanced psychiatry. All of those are specialized fields that not anybody that just have a bachelor's or a diploma in nursing can walk into a ward and take care of those patients. Specialized knowledge, skills and competence is necessary to ensure good patient outcomes.
Do you think that the career is perhaps not attractive to new entrants, matriculants, in trying to also establish what some of the reasons may be in this shortage?
I would say that it is not attractive because there are so many opportunities that gets created once you become a nurse globally, not just nationally. It's a profession to be very proud of. I sometimes think the sacrifice that has been witnessed during the COVID period has had a big impact on the perception of what nurses are really going through. You can just look at our tired workforce at the moment and the impact that it's had on their mental wellness. And despite all of that, they still have to come to work every single day to take care of our patients. And I think that might have scared off some of the applicants as well. But really, I just want to invite everybody to invest in a career in nursing. It will take you places and it will give you such satisfaction as well as reward, knowing that you have made a difference in someone's life.
Do you think that perhaps there's a shift in perceptions that may be needed for some people who may think that perhaps nursing is only for women or some of those narratives that are often thought of when one considers a career in nursing?
Absolutely. I have to say, though, that in the latter part, certainly, of my nursing career, there's been more interest from males to apply for nursing. And I'm sure that those that are in those positions currently will really tell the males out there that it is a very rewarding career. Wonderful growth opportunities as well. There has certainly been a 5% increase in the amount of males that has applied for nursing since 2020. So we really are very positive that more males will apply for nursing positions.
And when it comes to, action that is needed, especially looking at the dire conditions in the country's healthcare system, which have made it perhaps increasingly impossible for many patients to access quality healthcare services during times of need. Do you think perhaps, when it comes to the failure of government or management at clinics to act in ensuring that immediate action is taken to fill the gaps? And I mean, what we found is one nurse per 213 patients, for instance. That's really shocking. And it speaks to a lot of the gaps that we're seeing in the system. What will happen if immediate action is not taken?
Well, basically, we won't be able to deliver healthcare. Our healthcare system will fall down. Nurses are the backbone of healthcare. And it is evident in any health facility that you go to. We're not just there to do active nursing care. We're there to ensure that there is preventative measures to ensure people don't get sick. We need to give health education. And if all of that is not in play, primary health care is so important in the outcomes of a person's health. If we don't fill those gaps, our health system is going to be crippled. It's already crippled as it is. It's actually going to completely fall apart.
And if you had to describe your career, Merle, having worked as a nurse, what would you say has been rewarding for you to continue within the profession?
For me, it was making a difference in somebody's life. I'm a neonatal nurse at heart, and there was nothing as rewarding as to really be part of that recovery journey of a newborn from the time that they're born until the time that we can hand them over to their parents. Extremely rewarding. But apart from that, you form such firm relationships with the patients, the trust that they have in you, giving you confidence to try again and again and again. And apart from that, I really have enjoyed the growth that I certainly have experienced within nursing as well.
Very well. Thank you so much. Thanks for sharing your story. Merle Victor, the Chief Nurse Officer at Life Healthcare, speaking, of course, about some of the challenges and opportunities within the nursing profession.